Kennedy was diagnosed with type 1 diabetes 2 years ago. She wears 2 devices to regulate her insulin and monitor her blood glucose closely. She uses her cell phone these days for everything from talking to friends to listening to music. I'd like her to have an app that with one click will give her a dashboard of continuous feedback on how her diabetes and overall health is doing. The data entry features of the existing mobile apps are time intensive and add more time to her diabetes day. That's the last thing I want to do. The technology is here today, and we are programming an app that will flow Kennedy's data from any connected health device back to her dashboard so she can make adjustments in her care herself. I don't want her to spend a lifetime in specialist visits, experience blindness, or chronic pain. And above all, I hope she never has to be in a hospital again. I'm a pediatrician, and I've been seeing adults in my practice for 2 years now due to a deep need in our community. I find myself outraged by the poor health of these folks and the status quo of fee-for-service health care. I find it time-consuming and difficult to get people to change their behaviors. As a physician, I find it frustrating saying the same things over and over to people all day long. It takes intensive, frequent visits using behavior modification techniques, detailing the actions of their day, helping them continually make tiny behavior changes like buying fruits and vegetables, going for a walk instead of smoking a cigarette, and some strong visual reminders to improve health. Our app makes their data available to them in one click iPhone screen, all on one screen so they can see how terrible their numbers are. The data doesn't lie. Let's show patients their weight, blood pressure, and glucose measurements on an easy-to-access single health dashboard so they can make their own health improvements. Our platform does not make the user input their data from other devices. Rather, it flows the data from any of the top 100 connected health devices on the market. If our patients had this app with them all the time, visually rewarding them for drinking water, eating fruits and vegetables, and taking the stairs instead of the elevator, it would help them avoid the pain and suffering that's in store for their future. Our app will pull them back from the brink of a life lived in time-consuming specialist visits, hospital stays, certain disability, and painful death. Kennedy will spend less time feeling bad from high and low blood sugars if she has this simple tool to manage her diabetes herself. On behalf of the Personal Medicine Plus team, if you would like to see this kind of tool to manage your own health or the health of your employees, donate to our MedStarter campaign and you will have earliest access to our beta launch. If you have type 1 or type 2 diabetes, or if you're a Dexcom user and you'd like to try our tool, donate to become part of the Personal Medicine Plus Founders Circle. If you're a health innovator, hacker, entrepreneur, futurist, and you'd like to help us hack healthcare and end lifestyle disease, donate in our philanthropist donation and become part of our Founders Circle. If you're a physician who wants to rapidly accelerate the progress of your patient's health between your visits, or you're just a physician who thinks this is an awesome platform, donate in our physician special to gain early beta access. If you're a physician that is part of a mature, accountable care organization, or if you practice direct care or concierge medicine, or if you're in the payer space in charge of the health of large populations, donate to try out beta access in the platform. We need your feedback on version 1 quickly to see what to build for you next. Our developers are on hand to gain your critical insights to produce quick iteration and monthly release improvements. Help us help you in your struggles with the changing healthcare landscape. We want to help you create value in the new era of healthcare. Now we have some features in mind for our version 2, but we really want to get the version 1 dashboard into your hands 12 weeks from today for your feedback. Thank you so much for your support.